Welcome to our video on accessing care services during COVID-19 and beyond. This was recorded and the information is current as of July 2021. This webinar is for people who are caring for someone living with dementia and who are in need of services. You may be watching this webinar today for a number of reasons. Every person and family situation is different, but there are some common challenges we can discuss and some strategies to explore. While we might be able to see the glimmer of post-pandemic life, we are not quite there yet. While care services continue to be increasingly available, not everything is completely available yet, nor do we know if there may be restrictions in the future. If you find that you need to discuss anything that you've come across in this webinar, you're always welcome to call the First Link Dementia Helpline, and that number is 1-800-936-6033 and will be shared again at the end of this video. I'd like to start with a review of the Alzheimer Society of BC's role, who we are and what we do. We are able to provide support and information to people and families affected by dementia. Many of the families we support have been impacted by the changes to care services being offered and provided by health authorities during COVID-19. However, given the continuing uncertainty facing us, even as more and more of the population is vaccinated, there are many questions that we don't know the answer to. For example, we don't know what restrictions on visitation in long-term care might change again, or what day programs will look like as they begin to reopen. But we do know how hard the changes and challenges that have come with COVID-19 have been for many people living with dementia and their families. At the Alzheimer Society of BC, we are unable to make decisions regarding care services. We don't work for the health authorities or the government, and we are also not experts on the COVID-19 response. Today, we are going to focus on accessing services in the community and in your home. We will provide information that we've gathered through discussions with healthcare providers, our First Link clients and staff, and from online information provided by those different health authorities. We hope this information will help you access services if they are needed and help you understand what that might look like so that you can make informed decisions and implement strategies to manage those changes. I'm going to present information that I hope will help you access care services, assist you to consider the changes to accessing care services that the pandemic has caused, and provide you with strategies for managing these changes. First, I'll review the current public healthcare system in terms of accessing care services, and then we will talk about some of the challenges that COVID-19 has presented. I'll then provide some information about accessing care services during the pandemic and some tips for managing this, including making informed decisions in a way that increases your comfort level and that of the person living with dementia in accepting services moving forward. And finally, we'll discuss the importance of a caregiver backup plan for those who are primary caregivers, as well as the importance of self-care in maintaining well-being throughout these challenging times so that you can continue to stay healthy and well. Many publicly subsidized care services such as home support and home care nursing, adult day programs, respite care, and long-term care are accessed through 5 health authorities across BC. Each health authority has a department called Home and Community Care that is responsible for the operations of these care services available through BC's healthcare system. In the Island Health Authority, they have started using new and different language and are now calling the department offering these services home care services. For the purpose of this presentation, we will refer to home and community care, but if you are in the Island Health region, make a note and be aware that this is called home care services now. Regardless of the terms used, they are all required to follow the same legislation in BC and provide the same necessary services. The process for initiating services from home and community care have remained the same since COVID-19 began. This starts with a call to the Home and Community Care Office in your health authority to arrange an intake assessment with a case manager. Phone numbers for the office in your area can be found on the Government of BC's website by following the links to the health authorities' websites. This information you will find on the screen there. When you call Home and Community Care, you will likely have to leave a voicemail message and wait for a return call. Try to be politely persistent if necessary, while recognizing that the system is working to meet the needs and demands of many clients within your region. Because of the pandemic, the system may also not be currently operating as it was developed to. So please remember that the home and community care staff are doing the best they can under the circumstances. Wait times, assessments, and services offered may be varied and changing as the system has not fully recovered from COVID-19. So, who can make this referral to home and community care? Any individual or their representative, a family member, a friend, or your healthcare providers like doctors, nurses, or a social worker can contact home and community care. Once you connect with home and community care, a case manager will contact you to arrange an assessment to determine the care needs and the subsidy rate. After the assessment is complete and services are implemented, case managers work with families on an ongoing basis to identify changes of care needs and the transitions. There is detailed information about how the system works in the Home and Community Care Policy Manual, which is available on the Government of BC website. This manual provides detailed information about policies, describes eligibility for services and access, and explains the process for determining client rates. Case managers are the people who coordinate services. Their goal is to help people live at home safely and avoid unnecessary or premature admission to a hospital or care facility. They develop and review care plans and add additional support or care if needed. They will be up to date on the latest changes in system-related responses to COVID-19 and what services are available. If you already have a case manager or if you've yet to connect with the health authority, then home and community care case managers are the best people to reach out to if your care needs have changed. You may be finding that the pandemic has negatively impacted the person living with dementia's well-being or the caregiver's well-being. If either of your needs are increasing, then call your case manager or health authority to set up the intake assessment to see what supports can be implemented. They cannot know how challenging things have become if you don't communicate the changes that have occurred and the impact that they are having. When talking to a case manager, when you first meet them or at a follow-up meeting, it can be tempting to discuss all the things that are going well. It can be hard to tell someone that things have become challenging and to admit that help is needed. In order to know how to best support you and care for the person living with dementia, the case manager needs to know what has changed and what is too difficult, what safety concerns are present, and what the person with dementia needs in order to be well. It can help to have a list prepared before meeting with your case manager so that you can guide this difficult conversation and ensure you've told them what they need to know about your circumstances. Before meeting with the case manager, discuss this list with others who are in your close circle of support, like children or other family members. They might be also able to suggest areas where support is needed. Sometimes it can be helpful to have another perspective. As I said earlier, we don't know what the future of these services might look like. As we work our way back to more in-person meetings and our new normal, the priority is going to remain meeting the care needs of clients, but this will have to be balanced with protecting their health. Because this webinar focuses on accessing care services during COVID-19, we're going to turn now to the challenges that COVID-19 has created in terms of accessing services. But we also have a recording of our session called Accessing Services, where we dive a little deeper into initiating and maintaining a working relationship with case managers, and we cover some strategies for managing transitions to new services. You can find a link to this webinar on our website in recorded videos. I am certain that many of you will agree with me when I say that the COVID-19 pandemic has really turned our lives upside down. Over the past 18 months, we've all become familiar with the guidelines and the importance of hand washing, putting on a mask, and physical distancing. To reduce the transmission of the virus throughout our society, we've had to work together and follow these guidelines amongst others. During these uncertain times, family caregivers are encouraged to still reach out to their healthcare providers to stay informed of the new ways that they're working. In many cases, drop-in or unscheduled services won't be accessible. Appointments are still required. It's important to still engage with your healthcare providers and to continuing accessing services wherever possible for the benefit of your health. So, when you're inquiring about accessing services for the person living with dementia, consider these steps. Contact your case manager or get in touch with one through the Government of BC website we referred to earlier. Plan ahead and expect that there may be changes. Knowing that we're living in this new normal, think about what you need to do in your caregiving role and share that with your circle of support so they can jump in if needed. Focus on things that have changed, things that you need help with. Again, your case manager cannot know what has changed or how hard things have gotten unless you tell them. Although we can't tell you what they may be able to offer in terms of care services, they need to know that you're struggling. The changes have had a real impact on families, people living with dementia, and the staff working at all of these essential service sites. Some of the stories that we've heard from families are that more time is needed for everything. Although services are slowly returning, because of the backlogs, getting a hold of people can be difficult where call wait times have increased. Organising respite care or planning for accessing a volunteer program like BC 211, which provides home delivery, is helpful but also requires time. Reduced supports, such as access to regular programs in the community or other family members, can increase the need for more formal support. This is relevant to both family caregivers and people living with dementia. Uncertainty has been the key word for much of this past year and has still affected life of present because we don't know what the situation will be like in the coming months. We know that things are looking very positive at present and most of the COVID restrictions have been relaxed, but not everything is back to the way it was pre-COVID. And there remains a pervasive sense of waiting to see what happens next. For people living with dementia, changes in routine have been difficult. As vaccination rates rise, restrictions ease, services return, and we are able to see one another without masks, these positive changes can still be difficult for people living with dementia. Any disruption in a person's daily routine, including increased access to stimulating activities or a heightened level of anxiety around removing masks in public, may cause dementia symptoms to worsen. For healthcare providers, the protocols put in place to control and prevent infection have been essential to ensure health and safety for everyone. But this also made offering person-centered care challenging, and many of the protocols are still in place for healthcare workers. Working during this pandemic has created a heightened sense of uncertainty and stress, which impacts workers' own health and well-being. Many staff are experiencing changes in the workplace which can be difficult to manage. For example, being transitioned to new roles to support areas of greater need. I'd like to stop for a moment here to pause and have you think, what challenges or questions do you have around accessing services now? I will note here that BC is still in phase 3 of its restart plan. That means that there are more services being offered, but with enhanced protocols put in place to reduce transmission. In terms of accessing health services, the focus will continue to be on virtual phone option first, then in-person second. So we can expect this new normal for the foreseeable future. And while limitations on large gatherings are easing, it may take some time for larger programs like adult day programs to start operating at full capacity. Not everyone may feel comfortable being part of a large group of people. Because the situation is still changing, it's important to stay in touch with home and community care, to be informed of their changes and what to expect, and also to keep the lines of communication open with your case manager to ensure you get the support you need. This will help you to make informed decisions and plan ahead. Because everyone has a different situation and a different set of circumstances, take steps to think about what you need to support the person living with dementia and how you can get that support. Our goal is to ensure that you are able to seek out the information you need and to make an informed decision about accessing services. Start by getting organized. Identify the challenge or need. Consult with any friends, family members, or other people in your circle of support that you trust. They may be able to offer suggestions or another perspective. Make a list of everything that you want to ask of your case manager or healthcare provider and points that you want to make. It's important to think about what you need help with. It's okay, and it is necessary to be okay with asking for help. Prepare for the meeting by gathering information in advance. You will have more success if you spend some time preparing for the meeting, whether it is on the phone, in person, or virtually. Take some time to think about your purpose. When the call or meeting is over, what do you want to have accomplished? Think about who you need to speak with and about this particular matter. For example, if it's about home care, respite care, or transition to long-term care, it will be your case manager. For changes in symptoms or concerns about immediate health needs, you will need to contact your doctor. Always have a pen and paper handy so that you can record the answers to your questions and other important information. Keep records. When you get somebody on the phone, make sure you write down their name and their job title. If somebody is going too fast for you to take good notes, politely ask them to slow down and wait. If your phone is set up for audio recording, make sure you tell the person that they are being recorded. Also, record any decisions made and who you spoke with. Every time you make a phone call or have a meeting or appointment, write down the details in a notebook, a file, or somewhere. Make sure to keep track of who you spoke with, when you spoke to them, what you talked about and what actions they said that they would take, when and how you will know when the action is completed, what action you said that you would take, and whether you need to call them back and when. What if your home support is reduced? Let's consider an example of how to put this process into practice. When you're ready to seek out additional support, consider the steps I just mentioned. Get organized. Make a list of the changes that you've seen in the person and what you need as a caregiver. For example, my spouse is unable to bathe or clean himself, so I need help with personal care. Remember that you have the right to respectfully ask questions of your home care provider. In the next slide, I'll review some of the questions that you can ask the home care provider. Prepare for your meeting. Contact your case manager and be willing to ask for help. Too many people, especially spouses, try to do everything themselves. It's human nature, but it can be overwhelming. Now, wherever you are right now, repeat after me. You don't have to do it all by yourself. Ask for help and take it. Give yourself breaks. They are not a luxury, they are essential. In this example I gave before, ask for help with personal care, but also request a block of time for respite care, because while you're arranging for the person with dementia to have their care needs met, you also need to have your needs met too. Let's say it again. Breaks are not a luxury, they are essential. If you want services that go beyond what the case manager can offer, consider other options such as private home care or volunteer services. For example, BC 211 can connect you to volunteers who deliver groceries or prescriptions. Lastly, keep records. Record your notes of conversations with the case manager, including dates or other contacts, and follow up if things aren't quite what was discussed or if you need to make changes. As mentioned in the previous slide, the organisation that is delivering your home care or adult day program have measures in place to ensure that both clients and workers remain safe. As a recipient of these services, you can call the home care provider or adult day program manager to discuss your safety concerns and what you can do to work together. Some questions you might ask include, what is your policy on hand washing? What PPE are home care providers or staff using? When are they using it? Who is responsible for providing the PPE? Have staff received adequate training to use PPE properly and safely? What guidelines or safety measures are being followed? What happens when a worker is sick? What type of training do your staff receive on COVID-19? Do you have any vaccination requirements of your staff or day program clients? Also, remember, you can continue to do your part to keep care workers safe by continuing to wash your hands regularly and letting the home support worker know if you're sick and taking the appropriate steps to stay in a separate room while care is being provided. If you're using adult day programs, always inform the program manager as soon as possible if you're showing any symptoms and will be unable to attend. Should the COVID situation change and you need to think about stopping home care services, some questions you may wish to consider include, can the care needs be met without care continuing to come into the home? What are the person's wishes? How will their routine be changed? What are the trade-offs between halting home care services, reducing frequency of services, and keeping current levels of service? We are aware that some, if not many, families have had their home care services reduced and haven't had any say in the matter. If your home care services not returned to the level that you had pre-COVID, or to a level that is meeting your needs to continue to care for the person safely at home, revisit some of the points we just discussed. Contact your case manager, ask for help, and if possible, explore other options. Even if you take all the steps to make an informed decision, you may disagree with the level of care given in a community setting, at home, or in long-term care. Some strategies to consider if you aren't comfortable with the decision that has been made include making sure you understand the whole situation. Ask questions and listen carefully to the answers. Get all the details before you take action. You may want to take some time to gather your thoughts before starting the conversation. Jot down some notes and try to focus on the facts as objectively as possible. Humanize the concern. Without getting too emotional, make sure the person you are talking to or writing to understands the effect of the situation on the person with dementia and their family. Avoid arguing, but be persistent. This can be hard to do. Don't get pulled into an argument. Stay polite and respectful, even when others may not. If you're not having a successful conversation with one person, ask to see a colleague or a supervisor. If you're not satisfied with the quality of care your family member is receiving, start addressing the issue to the supervisor or manager and document these interactions. If you disagree with your case manager on a decision, you can request to speak with a care coordinator or manager. If still unresolved, you can report your concern to the Patient Quality Care Office. You will find information on the Patient Quality Care Office on the website of your local health authority or the Government of BC website. Lastly, express your appreciation for the person and acknowledge it is a difficult and stressful time for them as well. One of the consequences of COVID-19 is the use of personal protective equipment, PPE. That includes gowns, masks, and gloves. This changes the routine and the environment, which can make it difficult to recognize a person both at home and in a care home setting, since wearing a mask obscures a person's face, making them harder to recognize. It's not as easy to reassure someone with a gentle smile with a mask on. You may have seen an increase in communication challenges and changes in the person, such as confusion or refusal of care. This is to be expected when something in an environment changes. Here are some tips to support the person living with dementia to be more receptive to care. Some care providers have attached a photo of themselves smiling to their PPE or have printed a laminated photo card to show the person living with dementia. The healthcare worker in this photo shared it with us to show just this kind of thing. She said that it was a couple of weeks before the new photo ID cards came in, and the first day that she walked into this resident's room with her photo highly visible, the resident beamed and said, "Oh, it's you." If necessary, ask the care provider to speak slower and more clearly, as a mask can muffle their voice and make it more difficult to understand. Many people have gotten so used to wearing masks that they almost forget they have them on, and may certainly have forgotten the impact of the mask on communication. Stay with the person while they receive care if they appear anxious or fearful in response to the mask, to reassure them that everything is okay. You may need help with communication if the person living with dementia has trouble understanding what is being said to them from behind the mask. Just make sure that you maintain a good physical distance from the care provider. In a care home setting, restrictions on visitors have eased at the moment, but there is still a need for caution, and we know that things could change. Remind yourself that safety precautions are in place to protect the people in care. You may want to prepare for any changes by asking the care home how you can stay connected if visits become restricted again. There are two key questions to ask yourself that can help direct your conversation with the care home. First, what do I need to be okay with the current situation? For example, do I need updates from staff to see the person through a window or on camera, or to hear their voice on the phone? 2, what can I do for the person in care? Work with staff at the care home to determine what you can do to help stay connected. On top of visiting from afar, consider sending emailed letters and photos. So here's an important question to think about. If you or someone else who provides care for the person living with dementia were to get sick, either with COVID-19 or something else, what would you do? It's important to have a backup plan in case you or someone else who provides care or support were to become sick. A COVID-19 diagnosis means that you may have to self-isolate for at least 10 days, and anyone in your household may also have to self-isolate for another 14 days on top of that, even if they do not get sick themselves. That reality has brought home the need for backup plans, because not only do we not know what the future holds for COVID, there are still many ways that the caregiver can become sick or unable to provide care or support. We suggest that you connect with family members and other supports now to identify a backup caregiver, which can help alleviate a lot of stress if this happens. In times of crisis, it's reassuring to know there is a backup plan. This can lessen the worry about an uncertain future. For more information about what to consider in a backup plan and ways that you can put this into place, you can see our tool on our website called Ready, Set, Plan for Caregiver Absence that outlines some considerations for planning if you're unable to continue providing care. Remember that as a caregiver, you are the most important person in the life of someone living with dementia. And in these heightened times of stress, it is even more critical that you find ways to integrate self-care into your routine. It can be as simple as trying to stay positive. Although dementia brings many challenges and changes into your life, try to think about the positive aspects of your life. Remind yourself that as a caregiver, you continue to make a big difference to the person you are supporting. Do your best to stick to a routine. Both you and the person living with dementia will benefit from a regular and predictable schedule. This includes maintaining a consistent bedtime, getting up at the same time every morning, eating meals at consistent times, and scheduling physical activity, rest times, social time, and purposeful activities into each day. One thing in particular that was highlighted throughout the pandemic was the importance of staying connected. Consider whether you want to balance in-person visits with phone calls or visits over Skype to help you and the person living with dementia to stay connected to others. It can also help to avoid information overload. Many of us became acutely aware of the 24-hour news cycle over the past year. While it is important to stay informed, too much information can become overwhelming. Limit your news to reputable sources and consider setting a time limit or schedule times into your daily routine to get caught up on the news. Wherever possible, get support for yourself. Identify a trusted family member or friend who can be there for you when you are feeling overwhelmed, frustrated, tired, or just need a listening ear. Consider joining a virtual support group. We have many days and times available for caregivers and people living with dementia, with options for specialized groups available to suit your situation. You can call the First Link Dementia Helpline for more information. And finally, think about how you can integrate self-care into your day. It doesn't have to be big. Sometimes just taking a small break from the challenges of dementia can reduce the risk of burnout and give you a moment to regroup and move forward. We all know that living with dementia is hard, and we invite you to stay connected to us and to others who share many of your feelings and experiences. We are happy to set up regular phone support for you. We have telephone and video support groups for caregivers and groups for people with early symptoms of dementia. These groups provide a safe space to share your questions, concerns, and experience. We offer Moans in Motion online, a weekly fitness and social program for people in the early stages of dementia to attend online together with a care partner, family member, or friend. To register or find out more about our other supports and programs, call the First Link Dementia Helpline. And the number for the First Link Dementia Helpline is 1-800-936-6033. Thank you.